Hi friends, once again welcome back to my channel Mookambika Nursing. Friends, here we are discussing questions for nursing officer exam. In yesterday's video, we started one set of previous year questions and answers. In that, 25 questions we completed. Today we can see next 25 questions. Let's start the question. Which of the following is a type of learning in which a neutral stimulus becomes associated with a biologically significant stimulus, resulting in a conditioned response? Or options: option A, apparent conditioning; option B, classical conditioning; option C, observational learning; option D, insight learning. Here the question is, in which type of learning we can use a neutral stimulus become associated with biologically significant stimulus which produce a conditioned response. A conditioned response occurs in case of classical conditioning. Classical conditioning by Ivan Pavlov. Correct answer is option B. And the next question is, which of the following psychologists is most associated with the theory of the id, ego and superego? Our options: option A, Sigmund Freud; option B, Carl Jung; option C, Alfred Adler; option D, Erik Erikson. Here the question is, which psychologist proposed the theory which is related to id, ego and superego? This is coming under psychoanalytical theory, that is personality, structure of personality is under psychoanalytical theory, which is by Sigmund Freud. Option A is the correct answer. And the next question is, which of the following psychologists developed the first practical intelligence test? Options: option A, Lewis Terman; option B, Alfred Binet; option C, David Wechsler; option D, William Stern. The question is, who developed the first practical intelligence test? Okay, and the correct answer is Alfred Binet. Option B is the correct answer. The psychologist who developed first intelligence test. And the next question is, which of the following is a principle of learning proposed by Edward Thorndike? And our options: option A, law of multiple factors; option B, law of readiness; option C, law of exercise; option D, law of effect. And the correct answer is, it is option D, law of effect. And the next question is, which of the following psychologist is most associated with the hierarchy of needs? Options: option A, Erik Erikson; option B, Carl Jung; option D, Alfred Adler; option D, Abraham Maslow. Hierarchy of needs is by Maslow's theory of hierarchy. Okay, it is Abraham Maslow. Option D is the correct answer. And the next question is, which of the following psychologist is most associated with the founding of experimental psychology? Our options: option A, William Wundt; option B, Sigmund Freud; option C, Carl Jung; option D, B.F. Skinner. And the correct answer is, it is by William Wundt. Option A is the correct answer. And the next question is, which of the following sociologist is most associated with the concept of class struggle? Options: option A, Talcott Parsons; option B, Max Weber; option C, Emily Durkheim; option D, Karl Marx. Concept of class struggle by Karl Marx. Option D is the correct answer. And the next question is, which of the following philosophers said that man is by nature a social animal? Options: option A, Aristotle; option B, Plato; option C, Socrates; option D, Thomas Hobbes. Man is by nature of social animal, said by Aristotle. Option A is the correct answer. And the next question is, which of the following is a term used to describe the disorientation and anxiety that the people experience when they are suddenly immersed in a new culture? Our options: option A, acculturation; option B, ethnocentrism; option C, cultural relativism; option D, culture shock. Okay, the question is, a term which is used to describe the disorientation and anxiety that the people experience when they are in a new culture. Okay, if the person is coming to a new culture, he is or she is experiencing a disorientation and anxiety in that particular culture is called culture shock. Okay, the term is culture shock. Option D is the correct answer. And the next question is, which of the following sociologist is best known for his theory of social Darwinism? Options: Option A, Charles Darwin. Option B, Herbert Spencer. Option C, Thomas Malthus. Option D, Karl Marx. Theory of Social Darwinism by Herbert Spencer. Option B is the correct answer. And the next question is, which of the following is a term used to describe the number of males per 100 females in a population is? Options: Option A, sex ratio. Option B, gender ratio. Option C, sexual dimorphism. Option D, sexual reproduction. The number of males per 100 females in a population is known as sex ratio. Option A is the correct answer. And our next question is, which of the following is a key factor in social integration? Options: Option A, common values and norms. Option B, shared sense of identity. Option C, strong social institution. And option D, all of this. The key or the important factors of social integration, or for the social integrity, we need common values and norms, shared sense of identity, strong social institutions. So the correct answer is option D. And the next question is, a nurse is caring for a patient who is experiencing anxiety. The nurse planned to use a nursing theory to guide her care. Which of the following theories would be most appropriate? Options: Option A, Sister Calista Roy's adaptation model. Option B, Dorothea Arendt's self-care deficit theory. Option C, Virginia Henderson nursing need theory. Option D, Florence Nightingale's environmental theory. Here the question is, a nurse is caring for a patient who is experiencing anxiety disorder. Okay. Among this option, which nursing theory will guide the nurse to give appropriate care to this patient? Okay, patient who is experiencing anxiety. And the correct answer is option A, Sister Calista Roy's adaptation model. Okay. And the next question is, what is the correct ratio of chest compression to rescue breath for an adult victim of cardiac arrest? Our options: Option A, 5:1, Option B, 15:2, Option C, 10:2, Option D, 30:2. For adult victim, it is 30:2. Option D is the correct answer. And the next question is, which of the following is a correct order of steps for surgical hand washing as per the current recommendation of the Centers for Disease Control and Prevention? Our options: Option A, scrub hands with antiseptic soap for 5 minutes, rinse hands with water, dry hands with a sterile towel. Option B, wash hands with soap and water for 1 minute, rinse hands with water, dry hands with a sterile towel. Option C, apply antiseptic soap, scrub hands for 2 minutes, rinse hands with water, dry hands with a sterile towel. Option D, apply antiseptic soap, scrub hands for 1 minute, rinse hands with soap and water, dry hands with a paper towel. Here the question is, correct order of steps for surgical hand washing. It is for surgical hand washing. First we have to scrub hands with antiseptic soap for 5 minutes. Then rinse hands with water, dry hands with a sterile towel. Option A is the correct answer. And the next question is, a patient with a diagnosis of diabetes mellitus is experiencing fatigue. Which of the following is the most appropriate nursing diagnosis? Options: Option A, risk for unstable blood glucose level. Option B, imbalanced nutrition less than body requirements. Option C, impaired skin integrity. Option D, deficient fluid volume. Diabetes mellitus is a metabolic disorder characterized by hyperglycemia. Hyperglycemia means increased blood sugar level or blood glucose level. In diabetes mellitus, the most appropriate nurse has to focus. The most appropriate diagnosis is based on the blood glucose. Okay, so the correct answer is option A, a risk for unstable blood glucose level. And the next question is, a patient has a remittent fever. Which of the following is most likely cause of the fever? Options: Option A, infective endocarditis. Option B, tuberculosis. Option C, sepsis. Option D, malaria. Here the question is, patient has remittent fever. Remittent fever means the fever which has variation like more than 2 degree between morning and evening. Okay, but it will not reaches the normal. Okay, that is known as remittent fever. Here this remittent fever is seen in case of malaria. Option D is the correct answer. And the next question is, a patient has suffered a second degree burn to their hand. Which of the following is the most important intervention to prevent infection? Options: Option A, covering the burns with sterile dressing. Option B, applying a cool compress to the burn. Option C, cleaning the burn with soap and water. Option D, giving the patient pain medication. Here the question is, a patient with second degree burn in their hand. Okay, among this option, which is the most important intervention to prevent the infection? In order to prevent the infection, as a nurse, what we can do, which is the most appropriate? Okay, and the correct answer is, it is sterile dressing. Option A, covering the burn with sterile dressing. Next question is, a patient is receiving nasogastric feeding. Which of the following is the most important intervention to prevent complication? Options: Option A, flushing the tube with water before and after feeding. Option B, administering the feeding slowly over 30 minutes. Option C, using a feeding pump to deliver the feeding. Option D, checking the tube placement before each feeding. The question is, patient is taking tube feeding, NG2 feeding. Okay. And in order to prevent the complication, what intervention we can do as a nurse? Okay, we have to check the tube placement before each feeding. Option D is the correct answer. And the next question is, a patient is at risk for developing a bed sore. Which of the following intervention is the most important to prevent a bed sore? Options: Option A, keeping the skin clean and dry. Option B, using a pressure relieving mattress. Option C, repositioning the patient every 2 hours. Option D, applying a moist barrier cream. Here our question is, a patient is at risk for developing bed sore. He is at a risk. So what intervention as a nurse we can take to prevent the development of bed sore? What we can do? We have to position the patient, repositioning the patient every 2 hours. So while positioning, it will prevent, blood supply will increase, so it will prevent the risk for the developing bed sore. Okay, option C is the correct answer. And the next question is, a patient's temperature is 38.5 degrees Celsius. What is the temperature in degree Fahrenheit? Our options: Option A, 98.6 degree Fahrenheit. Option B, 100.4 degree Fahrenheit. Option C, 99.5 degree Fahrenheit. And option D, 101.3 degree Fahrenheit. Here we have to convert Celsius into Fahrenheit. The formula is F is equal to C into 9 by 5 plus 32. So the correct answer is, if we are doing the with formula, we will get 101.3. So the correct answer is option D, 101.3 degree Fahrenheit.